To effectively use the silver VDP-PRO for flexion distraction in the cervical region, it is important to start by flexing the cervical spine approximately 15 degrees. You can use an adjustable headpiece to tilt the neck or simply have the patient tuck their chin towards their chest on the adjusting table. It is important to have located the level of involvement and to place the tips of the VDP-PRO in the proper locations. For example, if you're going to use the VDP-PRO to address the facet joints and disc at C5-6, a very common area, you will place it vertically along the spine with 2 tips on C5 and 2 tips on C6. When you position the VDP-PRO, the legs need to be perpendicular to the spine. Take your time to position the device so it is perpendicular to the position on the spine that you will be addressing. You may want to do a little soft tissue pull stretch of their skin superiorly and inferiorly before you position the VDP-PRO to get the soft tissue out of the way. So once the device is perpendicular, apply pressure with your palm on the handle to preload and engage and depress the springs. This will ensure that you are applying at least the minimum amount of pressure necessary so the tips can penetrate deep enough into the soft tissue. This is calibrated to be 7.5 pounds. You may want to add an additional 3 to 5 pounds of pressure on the handle so the tips are pressing well into the soft tissues of the neck. This will depend, of course, on the size and condition of your patient. Be sure to keep an even and steady amount of pressure on the handle and to keep all 4 tips pressed evenly into the tissue. Then pull upwards with your fingers on the yoke. This will squeeze the yoke and the handle together and be closer. The legs and the tips will then open and stretch the soft tissue and gently distract the vertebrae. It is normal and desirable to see a small trough in between the superior and inferior tips on both sides of the spine. Hold the position for 10 to 15 seconds and then gently and slowly release the squeezing of the device and allow the fingers to go back to their starting position. You can repeat this 3 to 7 times. And as with all techniques, it takes time and practice to effectively apply it. But within no time, you'll begin to see the results and get referrals from patients you've helped with the VDP-PRO. And you'll be surprised at its simplicity and effectiveness. And you can visit us online and get a lot more information at www.vdp-pro.com. Thank you.